I thought Michelle would mention this, but this is a produced water tank, and it's about 10 feet away from an organic cornfield. Anyway, we took that picture about a month ago. So, what we think, I think everybody agrees, even now the state of New York, that we must understand human and animal impacts. And I think we don't. Dr. Perry will be talking a lot about learning more about the human impacts, but we would like to make a case that it's very important to understand animal impacts as well. We know we can get at many more numbers with animals. For example, in the case of reproduction, we can get a whole herd of cattle that are pregnant near a well at the same time and get better statistics than you can get in human medicine. On the other hand, though, the databases are far more sophisticated for human health than they are for animal health. So I think understanding both human and animal health will be important. We think that decisions need to be based on science. And we really don't have good scientific data on the health impacts of high-volume hydraulic fracturing. Now, since we're in the College of Physicians, I'd like to make an analogy here. When a pharmaceutical company develops a drug, it goes through some very sophisticated testing for safety. If they want to develop, for example, an arthritis drug, they cannot say, well, we know aspirin has been very safe for 60 years. It's been used for 60 years without a problem. Or they can't say that ibuprofen is very safe and just introduce the drug without testing. They have to go through specific phases of clinical trials in order to get it on the market. There's one case that I can think of where that broke down, and that is in with one drug, for political reasons, it didn't go through that process. The drug, its formulation, and its delivery device did not go through that process with the FDA. This is nicotine, of course. The tobacco industry spent many, many years denying that there was ever a problem. The burden of proof was on the public, academic researchers and government researchers. It wasn't on the companies, as it is for every other pharmaceutical product. So, what was the impact on public health? I think we all know that, and it's still a problem. So we have a situation very similar to that here. These companies that do high-volume hydraulic fracturing, the burden of proof is not on them. They take old methods of drilling and say they are safe, and then they just extrapolate to a qualitatively and quantitatively different process and expect us to believe that it is safe. But the burden of proof should be on them, not on us. Okay, Michelle mentioned non-disclosure agreements. This is a really serious issue and has been for some time. I'll go back to my pharmaceutical analogy, and if we think of something like Merck that developed the drug Vioxx. Vioxx is a non-steroidal anti-inflammatory drug. It got through actually all the clinical trials and got on the market, but the problem was that eventually people found that it caused heart attacks and deaths at a higher rate than the people that didn't take the drug. Now Merck was not able to go to the families of the people that died and pay them compensation and ask them not to reveal the medical records of those people. If they had done that, I believe that some people might be in jail now. But yet, this is a routine practice in this industry. I'm not saying that non-disclosure agreements are bad in general. They're a perfectly good business practice. I've signed them myself to protect intellectual property with pharmaceutical companies. But when issues of public health are at hand, this should not be something that is legal. Okay, testing. In almost all of the cases that we've had, there has not been adequate pre-drilling testing. I say that, but I have a really hard time knowing what adequate pre-drilling testing is. But I think from what we've learned from our study, we know some things about that. First of all, pre-drilling testing has to be done by an independent laboratory. It should be paid for, of course, by the people that are drilling. But the problem up to now is that the companies own the results, and they have the right to release the results, even of pre-drilling testing, or not, or they can just release part of them. Okay. What we believe is pre-drilling testing should be done, but it should be owned by the people that are impacted. Okay, it should include all substances used in the drilling process, as well as those expected to come up with the gas, those compounds expected to come up with the gas. Now, we can't do that because we don't know at each well what's being used. Now, you'll hear that the industry is now putting that information out on their website, Track Focus, and that's true. Of course, it's voluntary. They don't put proprietary chemicals out. They don't put it out when they don't want to. Nevertheless, they put it out there. But the problem is, they put it out there after completion. That information cannot be used for pre-drilling testing. So in some sense, it's not that useful. Okay, what we believe is there should not be proprietary chemicals in this industry. If they're drilling a well 150 feet from your home, you should know what's going in the ground. Okay, and we need to do testing within a fairly wide radius. I think a minimum, based on some of the studies we've seen, is 3,000 feet for water and about 5 miles for air. This is very, very conservative, though. Okay, but then how do we interpret the results of this testing? Well, typically what's done is to look at maximum contaminant levels. So if we take the example of water, maximum safe level for drinking water is the maximum contaminant level. The problem is very few of the compounds used in drilling have scientifically based MCLs. Okay? And those that do, many of them are just for acute effects at high doses. Okay. There's a very, very good paper here by Vandenberg et al. In Endocrine Reviews that covers this. I encourage you to have a look at it if you can. And what they show, and I think this is really well based in good science, is that drugs don't or toxicants don't always act in the same way at low doses as they do at high doses. At low doses, they can have one type of effect. At high doses, they may have no effect or something different. Okay, and so the problem with that is, when we start thinking about it, is over a long period of time, when you're exposed to these chemicals, you can have effects at concentrations well below the MCLs. So that's a serious issue. In New York, at least up to now, we actually have MCLs for every compound used in drilling. You know how they got those numbers? They made them up. And that's, I'm not joking. They actually made up values for compounds. They're not based on science. Okay? It's actually better than nothing. Because in some places, you could just say, if you don't have an MCL for a compound, and a compound is found in your water, then it's safe to drink, by definition. So having one that's made up is better than having none at all. Okay. But what we believe is no substance should be used unless an MCL has been experimentally determined and we consider low-dose effects. Okay. So where will the wastewater go? I think everybody has heard a lot about this. I'm going to skip down to the last thing called beneficial use. In Pennsylvania, produced water, or brine, they're legally able to use that to melt ice in the wintertime. As of at least a month ago, when I looked at the laws, it might have changed by now. What's not legal is to use it for dust suppression. Nobody told, apparently, the person who did this. we were driving by this road, watching them spread wastewater on the road. They actually had a chase vehicle there. They watched us while we go by, so we didn't stop and take pictures. So we went and hid and came back and took the picture. One of the things that I cannot convey in this picture is how bad that smelled. And I didn't take a picture of the duck pond on the other side of the road that will receive this runoff. So the reason I'm bringing this up is that it's very, very difficult to make regulations here, or to regulate this industry. In Pennsylvania, there are only a small number of personnel that are involved in regulation and enforcement. They can't be everywhere, and this sort of thing can happen. Okay, last thing I want to leave you with is some of the other issues. We all know about most of these. Increased truck traffic, crime. In Ithaca, we're certainly concerned about the impact on colleges, whether people bringing their freshman children to Ithaca for the first time. We wouldn't like them to get caught in hydraulic fracturing traffic. Housing values go up and down. When you lose your water supply, then the value of your house drops. But the last thing is something that really has become very important to me after a recent trip to Pennsylvania, Western Pennsylvania. And what I mean by that is we visited an area that was kind of interesting because it had a lot of wealth right next to a lot of poverty. We saw the farms of the people who had the wells. We saw their new barns. We saw their shiny new tractors. They were the winners. We saw the $1 million homes not far from them. Now, about 50% of the wells in the area have been impacted by drilling. So there was a solution to that. They started running city water. They ran city water to those farms that I referred to. They ran city water to the $1 million homes, but it stopped at the $1 million homes. People living in poverty were buying their water. They were paying for water buffaloes, etc. So what worries me about this is we have economic winners and losers. And those that are losers are the ones that are least able to help themselves. And what I believe, what I submit to you today, is that it's our job to care about these people. Okay? Not like a presidential candidate said recently. We should care about these people. Okay, so finally, what we always say at the end, without rigorous scientific studies, gas drilling boom sweeping the world, and I mean the world. They're drilling all over the world, Australia, New Zealand, not France yet, Ireland, Northern Ireland, UK, etc. This is truly something that's all over the world, and everyone globally should be concerned about it. If we do not have rigorous scientific studies, it will remain an uncontrolled health experiment on an enormous scale. And I believe those that are least able to help themselves will be the laboratory animals. Thank you.